My name is Jilu Rahim. I teach at the University of Liberal Arts, Bangladesh. We are speaking to successful tech entrepreneurs about how they have harnessed the power of and the possibilities of internet to start and operate a company in Bangladesh. This interview series is powered by Grameenphone. Today we have with us the founder and chief executive officer of Praava Health, Ms. Sylvana Quader Sinha. Welcome to our show, Ms. Sinha.
Thank you so much for having me.
So you grew up in the US, but you never forgot your roots. You visited Bangladesh at regular intervals. Can you tell us about your schooling in the US and how it kind of changed you to become who you are today?
Sure. So I grew up in Virginia, and I went to elementary school through high school in Virginia. And then I pursued university at Wellesley College in Massachusetts, which is a women's college. And I studied philosophy and economics there, as well as political science and political philosophy. And I developed a really keen interest in U.S. foreign policy, actually, as well as in international development, and was really intrigued by the role of the U.S. Internationally and the kind of opportunity for the United States to lead and influence politics all over the world. And in particular, I was always influenced actually by the role of the U.S. in the 1971 war. And so when I graduated from undergraduate, my first job was in management consulting, but I simultaneously also applied to graduate school, and so I ended up pursuing a law degree. In the United States, law is a postgraduate degree. And so I pursued a law degree at Columbia University and then a master's in development economics at Harvard. So I did those as a joint degree, and kind of they were the perfect combination of my interests in human rights and foreign policy and development. And I mean, I would definitely say my visits to Bangladesh as a child really inspired my interest in development. I was really intrigued by the juxtaposition of wealth in the country compared to what at the time was really massive poverty, which has improved dramatically since my childhood when we would visit. Um, but I would definitely say that my visits to Bangladesh as a child really are what inspired me to pursue the higher education that I ended up pursuing.
Can you tell us more about your work experience before you venturing into entrepreneurship?
Sure, yeah. So I worked in international law and development for most of my career. I worked at big law firms, international law firms, primarily out of New York City, and also was a foreign policy advisor on Senator Barack Obama's presidential campaign in 2007 and 2008. Again, I was very fascinated by the role of the United States and its opportunity to really lead with moral authority, which is somewhat lost in the 2000s after the invasion of Iraq. And so I thought it would be a really interesting moment to dive in and really cut my teeth on the challenges of diplomacy and development. And so when Obama won, instead of pursuing an opportunity in the administration, I chose to go to Afghanistan with the World Bank. So I was with the bank and other organizations in the Middle East and South Asia for most of 4 years. Working primarily on human rights, legal reform, and social policy. And then came back to New York, went back to big law, again, working in international law, primarily advising investors who were making entries into new markets. Emerging and frontier markets had always been my area. And was kind of seeking impact in my life and my work. And in the work I had done at the World Bank and other organizations, I had been really struck by the need for organizations like those, but by the deeper need for really sustainable solutions. And I really believe that the Washington Consensus and all of these activities and initiatives in the last 50 to 70 years to really promote the cause of development have been really important initiatives. But I think that what we've seen is the only truly sustainable form of development is through the private sector. and everything else is just a band-aid. They're needed band-aids, but there's only so much that you can do. And so, I think it's been a really interesting time for me to observe Bangladesh's growth from afar, to look at companies like Grameenphone, in fact, which was founded by Iqbal Kader, who had this thesis that you can improve the productivity of the citizens of Bangladesh. That will have a much bigger impact than any development activity. And I think his thesis has been proven correct, certainly. So, so I really started to be inspired by and believe in the power of entrepreneurship.
Can you speak more about kind of how you started using the internet, the role of internet kind of in your journey of starting Praava Health?
Sure. I think the amazing thing about the internet is it's really democratized knowledge, right? And so there's so much that we can all learn, and it's just made information so accessible to us across the board. And I started out as a healthcare entrepreneur, really coming at it from the patient perspective. I was not a doctor. I didn't have a public health background. And so what it really in the initial days did for me was help me to have access to information, help me to have access to people, help me to, reach out among my networks, to learn everything that I could about healthcare. It helped me to connect to patients. There are all kinds of communities on Facebook where you can, even today, go online and see patients, to really kind of get an understanding of what some of their pain points are in the system. And so I think there's many layers of where the internet has helped all of us individually, as well as different countries and societies to leapfrog. So for me, it helped me to kind of we all as Isaac Newton said, we all stand on the shoulders of giants, and I think the internet helps all of us to do that more easily than before. I remember when I was growing up, my parent I used to read a lot. I still read a lot, but when I was a kid, I was a voracious reader, and I remember I wouldn't know what a word meant, and my parents would always ask me to go look it up, and it felt like such a tedious task to go do that. But it's so much easier now to just go look up the meaning of a word, its entire etymology and history.
Your mother was hospitalized back in 2010 in a local hospital in Dhaka. Tell us more about that experience. How it helped you to do something in the healthcare industry?
Sure. I mean, it was a really eye-opening experience. She had to have an emergency appendectomy, and we were in the VIP suite of one of this fancy private hospitals in Dhaka, and despite that, the surgery was delayed, and then after the surgery, she had all kinds of complications, and it was extremely eye-opening to me to see how dismissive the doctor was to our mother's suffering and to all of our concern. And I've told the story before that I'll never forget the one day when she was really suffering, and my sister and I ran after the doctor up 2 flights of stairs to get him to answer our questions. And this is us being two self-possessed, highly educated people. And we had to really beg him to give us his attention and answers to our questions. And most people don't necessarily have the confidence, or it's a very intimidating situation to be in that kind of a situation. And there's always a disproportionate power dynamic when you have a doctor and a patient and the patient's family. And so it really opened my eyes to kind of the underlying challenges of the healthcare system in Bangladesh. We ended up airlifting my mother to Bangkok, where she actually had to have another surgery. And then a year later, she had another surgery in the United States. So as I mentioned, I was not a healthcare person by training, but I knew that this was not right, that we had to leave the country to access care. And it really got me thinking that Bangladesh is at this amazing moment of its growth. And there's a huge segment of the population that has an appetite for and an ability to pay for quality healthcare services. And they deserve better than needing to leave their country for care.
Absolutely. Every day, around 1,000 Bangladeshi apply for Indian medical visa. A lot of people
up to 2,000 actually, yeah.
Oh, it is 2,000. Wow.
Yeah, it's 1,000 to 2,000 daily. Yeah.
Yeah. Last time I checked, it was around probably $2 billion in 2018, I guess. Bangladeshi spent in India in medical tourism, and probably around 10 to 15,000 Bangladeshis goes to Malaysia. A huge number of Bangladeshi goes to Thailand and Singapore as well. But I know that you see yourself as more as a service delivery company. Can you tell us about how kind of you are trying to make kind of life of the people in this country better with your company?
Sure. So we're really trying to build a better patient experience. I think that, patients, when they come, any moment that they come to visit a doctor, they even call their doctor or the call center of the healthcare facility. They're in most cases, they need help. They're maybe stressed about themselves or their loved one's health, especially I think we're seeing right now, there's so much anxiety around the COVID-19 virus. And what we're really trying to do is build a better patient experience that's powered by international standards, doctors, quality diagnostics, and technology. And to really just elevate that patient experience, patients deserve to be treated with dignity and respect. Our doctors spend a minimum of 15 minutes with each patient. This is a country where the average amount of time doctors spend with patients is actually 48 seconds. By really putting an emphasis on that doctor-patient relationship and really focusing on preventive health, really focusing on wellness, we have already seen initial evidence that we've been able to reduce hospitalization rates. And we think that trend should continue. It's a little bit difficult for us to really understand the impact of our work because there isn't a lot of baseline data on patients in Bangladesh, but we've done our own pilot studies. And so yeah, really an elevated patient experience. The idea is really integrated outpatient care. Again, one of the other novelties is we have a 10-story building in downtown Dhaka in Bonani that is actually outpatient center. We don't have any beds. You can't stay overnight at Praava. The idea is really anything you need in an outpatient setting, you can come to access at Praava first. This is something that is very novel in Bangladesh because most people, if anything goes wrong, immediately they go to a hospital. That's actually not necessary. And hospitals are a classic place where you can catch infections or, in the current circumstances, a virus, And so there is certainly an increased and heightened need for outpatient centers like Praava. The other thing is we've kind of brought care not only from hospitals and into clinics, but also into homes. So we've been offering home services for more than 2 years at Praava. We've also rolled out telemedicine and virtual care. And so basically you can, video chat or talk on the phone with the doctor from anytime, anywhere at your convenience. You can also order drugs to be delivered to your doorstep. From our model pharmacy, we source drugs directly from the manufacturers. You can also have your sample collected from your home in Dhaka City. So far, we're only collecting samples in Dhaka. But this is kind of what we're doing, is really trying to make healthcare easier and make it an elevated and better experience.
You have also kind of rolled out membership plans, which is kind of very different, or probably very not a lot of kind of companies did it. So can you tell us about kind of what's your kind of goal with the membership plan, and how kind of what are kind of some of the trends that you are seeing in the membership plans?
Sure. So the membership plans are basically like outpatient insurance packages, whereby you pay a flat rate for unlimited access to services. So actually, currently for a price point starting at 3,500 Dhaka, you can come see a doctor or talk to a doctor over video chat every single day, and you don't have to pay anything additional on top of that. So the idea of this is it basically incentivizes the patient, because they've paid the flat rate, to see a doctor whenever they need to, not to wait till the last minute. But it also incentivizes us as providers to keep the patient healthy. So, we're not necessarily trying to, there's a lot of perverse incentives in the healthcare system in Bangladesh, which I think is part of why the trust is lost. Doctors are, over-ordering drugs, over-ordering tests. Their incentives to drive people toward hospital-centric care. Our incentive is actually, we want to keep people out of the hospital, and we want to keep people healthy. So that's the kind of idea of the membership plans. There's a range of offerings, and so the more expensive plans actually include coverage for sufferers of chronic disease like diabetes and heart disease. Those plans actually include all the diagnostic tests that are required traditionally for patients suffering from those conditions. And we've actually, I think in the next in the next few weeks, we're rolling out a membership plan for unlimited access to video consults for you and a family of 4.
We are going through a pandemic, which is a black swan event. Can you tell us a little bit more about how kind of the pandemic? Did you see any kind of growth in kind of number of patients, or kind of how pandemic kind of help you to kind of change the course of action for your company?
Sure. Yeah. It's been a really interesting moment for us because, we're a new company. We've been trying to serve the community as best as we can. But there has definitely been increased demand for our services. And we've been struggling to keep up with that demand. Nobody in the world, no healthcare provider in the world was really fully prepared for what this pandemic would bring. And we were certainly in that same group. But it's increased our patient base dramatically. Our corporate clients have also increased. I think we have a number of corporate clients who have basically signed up for hotlines for their employees so that their employees have, access to talk to a doctor at any time. And so that's been a really interesting new service line that we've offered. We already had, 70 plus corporate clients, but that number is, I think, nearly tripled now. After the last few months. And it's not just that the number is tripled, but all of a sudden all those corporate clients are really hungry for services for themselves and for their employees. And so we've been really trying to keep up with that. As I mentioned, we've rolled out new service lines. So immediately when the pandemic hit, by the end of March, we converted 95% of in-clinic consultations to virtual consults. So that was a very quick pivot and shift for us, because we really wanted to discourage our patients from coming into the clinic. Because, as everyone knows, and we hope will still be following, you really should avoid going out as much as possible to risk, to avoid spreading the virus, or contracting the virus. And so we strongly encourage people to stay home and access services from home as much as possible. This is also when we rolled out the online pharmacy delivery service that I mentioned. So it's definitely changed our business. We've also made some steps to actually develop a software tool for remote management of COVID. 80% of COVID patients actually generally, that's the global data, don't require hospitalization. And so as a country that is already overburdened in terms of the health system, we decided, how can we, again, focus on keeping people out of the hospital? And so we developed this tool that allows patients, based on their risk profile, to self-report symptoms and be managed by a remote medical team. And so based on the self-reporting of symptoms over different frequencies of time, the medical team reviews, and if certain triggers are met, they might escalate and say, okay, we need to do a video consult, or we need to recommend this patient to go directly to a hospital. They'll make the call in that way. And our initial pilots have shown that 86% of patients who have gone through our software tool called Brano actually do not require hospitalization, whereas on average in Bangladesh, only 49% of patients in Bangladesh are not requiring hospitalization. So we're very, very happy with the outcomes. I think this is another example of how the internet can be used to really promote better health.
Starting a company in Bangladesh in the healthcare space, I can only assume the kind of challenges that you have experienced. Can you tell us a little bit more about kind of the initial challenge that you faced when you started? And what are some of the challenges you are facing right now of scaling your operation?
Sure. So I think, certainly it's always difficult to start something. I think one of the challenges that I faced was that I was a relatively unknown entity in Bangladesh, having never lived there before. I was born and raised in the United States, as you mentioned at the beginning. And but I think I tried to kind of use that anonymity to my advantage. And just kind of tried to lay low, do my homework, learn everything that I could, slowly get to know people, meet people, build my tribe of army, really, of people who are now trying to build the best healthcare company in Bangladesh. And so, but I do think there were many people who advised those people who ended up joining my team, that, this will never get off the ground. It's too big a dream. It's too ambitious. This can never be done. But I'm very grateful that that those people joined forces with us, and it helped us get to where we are, and are still fighting hard every day to face the challenges that we do face. I mean, what are the challenges? I would say it depends on the day. There's different types of challenges on any given day for any entrepreneur. But I think access to capital remains a big challenge for all of us who are trying to build businesses in Bangladesh. We have a huge market opportunity, but I don't think that globally investors are yet aware of it, to be honest, and they don't have an appreciation for the opportunities in Bangladesh. And so it can be a challenge to attract foreign capital. And yeah, so I think that that's something that we struggle with to really achieve scale, because in order to really build this out, we will need significant capital to do that. But we've been very lucky and been able to attract a really wonderful set of investors who believe in us and who have supported us along the way. So I'm sure we're going to continue to be able to face those challenges. What I always say to my team is, and even during COVID, right? Like it's been a really challenging time for all of us. Teams working virtually. It's trying to serve our patients. We were the first private lab to get approval to do COVID testing. We were overwhelmed with demand for that service, and even now there's been a huge crisis of confidence in the private health system because of the incidents in July with labs that were defrauding patients. Really, these horrific examples. But what I always say to my team is that the challenges that we continue to face are not as big as the ones we've already faced. And so just remember how far we've come and keep going.
Where do you see the kind of future of your industry, the service delivery industry, or kind of health tech in general in Bangladesh and also probably around the world?
There are a lot of really interesting models that have come up. I do think that health tech in a silo has these challenges. And I think that's one thing that traditional technology investors because sometimes struggle to get their head around. The thing is, if you look at a business like ePharma, right? ePharma is a business that can stand on its own, and you or I can avoid going to the pharmacy for the rest of our lives if we want to. We could order from ePharma forever, and we would never have to walk into a pharmacy, right? When it comes to healthcare services, we will not be able to avoid never going to a doctor, right? So health tech in the purest sense, in terms of telemedicine and other offerings, are supplementary, or they're only one part of the value chain of services that an individual needs over the course of their lifetime. And so that's why, we at Praava have tried to build really a platform and an ecosystem around the kinds of services that someone needs. So we want to really be with you, as the NHS says, from the cradle to the grave, and so that means that we use technology to increase access to our services. We use technology to increase access to information for our doctors, to help them to apply protocolized medicine and triage patients most effectively. But we also put a really big, value on the time that the doctor spends with the patient, the engagement of the doctor with the patient. All the purpose of all of the other technology investments are really to improve efficiency in the system, to really give doctors that time to engage with patients, to listen to them, to really get a full picture of the challenges the patient is facing, which inevitably improves diagnoses, but also improves patient outcomes. There's a lot of evidence of that. And so I think that one of the challenges health tech faces, it often thinks about the technology in a silo, but what we are looking at Praava is again this ecosystem platform concept, whereby the whole is worth more than the sum of its parts, and so we have the ePharma piece, we have the telemedicine piece, we have brought Bangladesh's first patient app, and we have a 10-story building in Bonami, and all of these pieces come together again to really serve as a one-stop shop for all of your healthcare needs, anytime, anywhere.
So I know at Praava Health, you're kind of value-based healthcare. Can you kind of speak more about value-based healthcare?
Yeah. So value-based healthcare is the concept that it's a concept coined by Professor Michael Porter at Harvard Business School, and the idea is that it isn't appropriate that when people keep getting sick, healthcare facilities keep making more money. So how do we as providers align our incentives with patients to keep them healthy, to get them healthy, and to keep them healthy? And so that is really the core concept behind our membership plans, whereby, again, you pay a flat rate for unlimited access to services to really incentivize us to really invest in your better health. So broadly, that's the concept. But value-based care means that the incentives of the patients and providers are aligned. It means that you're using technology smartly to increase access. It means you're basing care on international standards and protocolized medicine.
Talk about your experience when you had idea. What are some of the things you did before you actually kind of went on to kind of work with the company, or you made your first hire?
Sure. Yeah, no, that's a great question. I mean, look, every entrepreneur's story is different, and I can only share my experience. But yeah, I spent about a year actually doing research. So from August 2014 to August 2015, I kind of went on a global listening tour. I spent time in Bangladesh on the ground, and I literally listened to anyone who would talk to me because I had not lived in Bangladesh before. But anyone I talked to, if I asked them what was their experience in healthcare, oftentimes I would not be able to even get a word in for the next hour, because patients wanted to talk, patients wanted to share their experience. So I spent a lot of time listening to patient stories, but I also spent a lot of time studying different business models and different models for healthcare service delivery all over the world. And I think this is the really exciting thing about working in healthcare, and what we've seen during the pandemic is that no country's really figured it out, and the number of countries that have handled the crisis well could probably count on one hand. And so even in the richest countries in the world, you have systems that are failing, you have people that are dying who shouldn't be. And so there's a lot that can be learned from that. There are pockets of brilliance in all of these countries as well. And Bangladesh in particular actually has done really well on social development indicators and on public health indicators. And if you look at maternal, newborn, and child mortality rates, they've fallen dramatically in the last 25 years. And that's largely due to investments in primary care and investments in improving vaccinations, improving access to information. Those things exist in the public system, but really interestingly, they don't exist in the private system. So I observed all of these things globally and in Bangladesh, and spent time getting to know entrepreneurs, getting to know, getting to know patients. I spent a long time before I actually started building out my team. And in the course of meeting patients and meeting people working in healthcare, I started to meet the people who have now joined my team. I met my lab director, I met my founding IT director in early 2015, actually. And then, but I didn't hire my first employee until February 2016. It took a long time getting to know those early employees before actually starting. I do think that it's funny you mentioned students. I do think that young people sometimes romanticize the concept of entrepreneurship. And I personally am grateful in a way that I came to entrepreneurship later in life, because I think it gave me and taught me patience. And I have a little different perspective on wanting to build something that's really sustainable and that's bigger than me, that's going to live well beyond me. So I would recommend young people to kind of be patient with yourself, be patient with your idea, and everyone wants to reference the amazing story of Mark Zuckerberg, but even Steve Jobs, it took him many years to build what he did at Apple. And most entrepreneurial stories are not such a fast rise, and sometimes I think the ones that are the faster rises don't stay at the top as long, and so I prefer a slow and steady pace personally.
This pandemic exposed the public health all around the world. Even in the US, if we talk about US, more than 170,000 people dead. The other rich countries have not fared better. Do you see more tech companies coming into this space?
Definitely. I think that it's interesting that you mentioned that, because I think one of the challenges that we faced with our fundraise is that we're not pure tech. we're infrastructure plus tech, right? And it's that brick and click model that I mentioned. And sometimes because it isn't pure tech, we've struggled to raise capital. But I frankly have said consistently that, I don't think that when I think about what Asia needs in terms of healthcare, it isn't another app. It's actual infrastructure. It's actually better labs, more MRI machines, more beds, better trained doctors, better trained nurses and technicians. Those are the core things that we really need, and technology can increase access, it can improve efficiency, it can help with training. There are things that it can facilitate, but at the core, what we need is infrastructure. And I think the pandemic has truly highlighted that, and I hope the investment community will step up. I think that it is starting to, but some of the larger organizations are developing allocations to really strengthen systems, because that's, as you mentioned, that's what we're seeing being highlighted here is the weakness of our systems.
So now where do you see your company, Praava Health, 5 to 10 years down the line? Can you speak more about that?
Sure. Well, I hope that, we'll be well on our path to building the best healthcare company in Bangladesh. We'd like to be the most trusted by patients. I think that we're really here for the patients, and earning the trust of patients really takes one patient at a time, and it's a very fragile and difficult badge of honor to earn. So we're working on that. I hope that over the next 5 to 10 years we will have earned that. I'd love for us to have scaled across Bangladesh over that period of time, and maybe even beyond. I think there are aspects of our model that can be applied in other markets, and so we're really excited to see where that's going to take us in the future.
Can you tell us a little bit about your personal internet habits, how you use the internet to be more productive and effective? Because you're running a company remotely.
Sure.
I know, I mean, there is no work-life balance in an entrepreneur's life. But then again, what do you do to make yourself productive on one hand, and also, if possible, drawing a balance between work and life?
So I mean, I definitely really heavily rely on technology to improve my efficiency. I don't know what I would do without my smartphone. But I use, I'm constantly on WhatsApp. I'm constantly on Slack, and my Gmail, of course. And we use Trello to help to manage, to project manage all of the different workflows we have at Praava. I think that, automation is key to improving all of our efficiency. And what we always say at Praava is, automate wherever you can. Again, in healthcare, I think the human touch remains really, really important. But where we can replace any individual's efforts with automation, we should and need to, so that we can reserve the human touch piece for the real patient interactions.
You started your journey in 2014. Now we are going through a pandemic, 2020, almost the end of 2020. So in the last six and a half years, how did Praava Health, the company, has changed you?
Well, it has changed me, I think, in really positive ways overall. I definitely sleep a lot less than I used to, but that's again the life of an entrepreneur. But I think, it's honestly, I mean, this may sound cheesy, but it's one of those experiences. We actually just celebrated, we cut the ribbon on August 24th to 2017. So we just celebrated 3 years of cutting our ribbon. And, we had unfortunately, we couldn't have a party, so we had a virtual celebration with our team. But working with this team has honestly been one of the biggest honors of my life. And it's one of these experiences that just makes me proud to be alive. And I'm just really grateful that we've been able to attract such amazing people to work together and build this dream that's, like I said, bigger than any one of us. And, even when we have those really, really hard moments, it's the patient stories that come back to us, the people who tell us they never imagined a company like this could exist in Bangladesh, the people who tell us, they send all of their friends and family to us, the people who tell us that, the way the doctor followed up with them, again, they never thought possible. those are the stories that make it all worthwhile, and just to have come together as a team to build that dream has just been, it's wonderful to be focused on something so optimistic intrinsically. Entrepreneurship is an intrinsically optimistic endeavor, and with all that's happening in the world, especially now, I'm grateful for the work and to be able to focus on something positive.
So can you also speak a little bit more about work culture that you are trying to build in your company?
You know, we're trying to build a company of leaders. I think, you know, we want to build a company where every single person feels ownership over our mission and feels connected to what feels connected to the patient care that we're trying to build. And I think that again, it's bigger than all of us, but also every single one of us on the team has an incentive because we have someone we love who we want to have access to better quality healthcare. So we have what we call our SMILE values. So SMILE, each letter represents one of our values. So S is for service, M is for my Praava, again, that concept of ownership. I is integrity, L is listening, and E is excellence. And so, you know, we try to really instill a culture that's driven by those values and really puts patients at the heart of every experience. It's been a really challenging time for many of us who are entrepreneurs, given the global recession, and you know, the team has made sacrifices, frankly, in the last few months, and I think that it's been really inspiring to see everyone step up and despite all the challenges that people are facing professionally, personally, in their own families, anxiety that everyone has to protect themselves and their families, but still the sacrifices that people are making to step up and serve our patients as best as possible. Again, it's been really inspiring for me. I mean, I'm here representing this amazing team. Honestly, it's you should do another interview with some of them.
Yeah, definitely. So on a more personal note, what are some of your hobbies? Did your hobby change because of pandemic?
Yeah. Well, I mean, I haven't been able to exercise as much as I used to, I have to say, or like not as in the same way that I used to. That's been hard. I think all of us mentally, you know, need that release. But I do try to walk, even when I'm, you know, on my calls with my team. I'm constantly walking, and so I still get like I actually try to get 15,000 steps a day. So that actually helps me mentally as well, and physically I think is good for me certainly. Because otherwise we're all like cooped up, you know, at home, and so it's challenging. I don't know that I have much time for too many hobbies during this time, as the leader of a healthcare organization during a pandemic. But hopefully life will return to some kind of normalcy soon. I'm sure we're all catching up on Netflix and whatever we can access at home in terms of entertainment.
It has been an absolute pleasure talking to you, learning about your company, your vision and your ambition and culture that you want to build around in your company. We can only hope you'll grow bigger, make a difference in the healthcare space.
Thank you so much. We hope so too. Really appreciate your taking an interest in our work.